Okay. All right. So as you've heard Erin's story, she's absolutely amazing, and that's why it's such a gift for me to be a pediatric oncologist. I mean, who wouldn't want to get to be around Erin all the time? I mean, it's just lovely. And actually, the even better news is I don't get to see her that much because she doesn't need me. And she's busy doing her own activities, which is a great thing. So anyways, I know most of you probably were diagnosed with cancer as an adult, and so I do have some slides because I think there can be a little bit of overlap, but obviously Dr. Meyer is going to be following me shortly, and I think what she has to say is also important and maybe more applicable for most of you. But anyways, I was asked to talk a little bit about secondary cancers in survivors of cancer as a child. And when I was first asked to speak, I have to confess I wasn't totally sure about the topic. It was second cancers, and so I wasn't sure whether I was supposed to talk about a first cancer coming back, so a recurrent cancer, or whether I was supposed to talk about a new second cancer. Or maybe things that might predispose you to getting multiple cancers. I wasn't totally sure, so I'm going to do as Yogi Berra says, when you come to a fork in the road, take it. And I'm actually going to try and cover a couple of these topics, at least briefly. So just to give you a little bit of background, fortunately, cancer in kids is actually pretty rare, much, much rarer than it is in adults, which is a good thing. In the United States, there were not quite 16,000 new cases of cancer diagnosed in children and adolescents less than 19 years of age this past year. Dr. Meyer knows the adult numbers much more than I do, but in adults, you're talking about hundreds of thousands of adults diagnosed with cancer. So clearly the numbers are much smaller in pediatrics. Another way of looking at it is to say about 1 in 285 children will be diagnosed with cancer before the age of 20 years. And what's great about this, obviously not great that kids get cancer, but what's great is that we're doing so much better than we used to do with treating these kids. So that as of today, March 10th, 2015, 80% of kids diagnosed with cancer today are going to be 5-year survivors. So that's a outstanding number, but obviously not good enough. And that's why we're continuing to work to find better cures. Because most of these kids are surviving, when they become young adults in their 20 to 40s, we're now seeing that 1 in 530 of these young adults are survivors of childhood cancer. Despite this, our work isn't done yet because cancer is still the second leading cause of death in kids, so we still need to keep working. Accidents are actually the leading cause, but if you're looking at diseases, cancer is the leading disease that causes death in kids, more so than kidney problems, more so than cystic fibrosis, more so than heart problems. So it's an area that still needs attention. On this slide, I've listed some of the more common types of cancer that we see in kids. It's divided into 2 different age groups. On the left, you see the cancers that are most commonly found in kids between 0 and 14 years of age. And on the right are kids between 15 and 19, so more of our adolescents, you would call them. So let me just start with the group on the left, because that is actually the largest group of kids, those between 0 and 14. And the most common type of cancer is leukemia. Acute lymphoblastic leukemia is by far the most common, as you can see. Just shy of 3,000 kids a year are diagnosed with ALL in the United States, with brain tumors being number 2. Now, brain tumors does include a whole wide range. You have tumors that are really pretty benign and don't require a lot of therapy, and then you have other brain tumors that are much more malignant. But if you lump them all together, brain tumors are actually the second most common cancer in kids. Third is neuroblastoma, but here it kind of blends, as you can see. You know, 7% are neuroblastoma, 6% are non-Hodgkin's lymphoma, 5% are kidney tumor. So these numbers are all very similar, so we kind of lump them together, but leukemia and brain tumors are the top two. When you go to adolescence, lymphoma is definitely the most common type of cancer. Here we see thyroid carcinoma, which we really don't see in very young kids, but is more of an adolescent and an adult type disease. But once again, brain tumors are near the top of tumors that we see. This figure kind of shows you the trends of what's happening as far as the number of kids that we're seeing with the various types of cancers over the years. As you can see on the left-hand side, this dates back to 1975, and the data is good. We have data up through 2010. And each of these bars represents a different type of cancer, with ALL again being at the top because it's the most common type of cancer in kids. Brain tumors is in red, that's the second most common. And then lower down you see the lymphomas and bone tumors and things like that. It's not important to know what every single line is, but the point of this slide is to show you that for whatever reason, and we don't know what the reason is, but it does seem like the incidence of cancer in kids is rising over time. So we in 2010, and it holds true for 2015 as well, the number of kids diagnosed with cancer in the United States is higher than what it was back in 1975. And again, we don't know why. In kids, you know, you don't have as many of the environmental factors like smoking and alcohol use and things like that. But you still have secondhand smoke. We don't know the causes in pediatric cancer, to be honest with you. We're still working on that. I just wanted to make a small point here. You see this big jump in brain tumors back in the mid-1980s. That wasn't because the number of kids with brain tumors suddenly increased. What happened was this reflects the use of MRI scans. So before the 1980s, we didn't have MRIs available to us. So we just weren't making the diagnosis. That doesn't mean that kids didn't have brain tumors. We just weren't able to diagnose them because we didn't have the tools. So some of this increase does reflect better ways to diagnose cancer. And it also may partially reflect the fact that kids are surviving other things, you know, like infections. You know, when you go to other parts of the world, cancer may not be so prevalent because unfortunately those kids are dying at a very young age because of infection and malnutrition and things like that, and they're just not surviving, living long enough to get cancer. So this is actually in part due to our society and our ability to improve on other things. But the good news is, the bad news is we're seeing more cases. The good news is the kids are doing much better. So where the incidence curves are all going up, the death due to cancer are all going down for all of the types of cancer. And so this is what we're really excited about, is the fact that we are doing so much better with treatment and kids are living longer, which is obviously a good thing. You know, most of the time, if kids are going to recur, their cancer tends to come back sooner rather than later. So 5 years is a fairly good benchmark for us. But it's not perfect. You know, occasionally there are late recurrences. There was a study that was published a few years ago from the National Cancer Institute that was looking at late relapses. So this is patients who had been diagnosed with cancer as kids and were now surviving 10 years, 15 years, 20 years after their initial diagnosis, and looking to see whether their primary tumors recurred or not. And the number's not zero. It is a real number. It ranges between 4 and 6% the longer you live. But the other way to look at that is that means almost 95% of the kids who are diagnosed and are living 10, 15, 20 years don't have a recurrence. So I'm more of a half full type of person. A cup is half full rather than cup is half empty. So I look at this as, you know, almost 95% of the kids are doing great. They look to see if there were any trends, whether It was what may influence the recurrence of the primary disease later on, and they found that for some reason, and again, we don't have the explanation, but kids who were initially diagnosed with Ewing sarcoma have a little bit of a higher risk of relapse later on. And also astrocytoma, a high-grade astrocytoma, a more malignant type of brain tumor, also may relapse later on. Additional factors, risk factors for late relapses, in addition to the diagnosis, were the type of treatment, if you got a combination of chemotherapy and radiation for your tumor, as well as kids who were treated earlier, many years ago, as opposed to kids treated more recently, and kids who were shorter from their initial diagnosis. So these were the risk factors that were looked at and found to be significant. This just shows a figure of the same type of slide that I just showed. Again, it's Ewing sarcoma. It does seem to have a higher risk of late relapse, but again, we're talking about 5%, 6%, 7%. The vast majority of these kids are not having relapses late. And the same thing for the astrocytoma. Let me shift gears just slightly and go from talking about recurrence of your primary tumor to developing a second cancer. This means a cancer that's separate or different from your initial primary cancer. We've gotten a lot of data on second cancers from the Childhood Cancer Survivor Study. And what that is it's a cohort or a group of survivors of childhood cancer that was brought together in order to look at various questions or various issues in these long-term survivors. It's obviously a unique population. This cohort consists of children who were treated between January 1st, 1970 and December 31st, 1986. The diagnoses are listed here. The kids had to have had either leukemia, lymphoma, neuroblastoma, soft tissue sarcoma, bone tumor, brain tumor, or kidney cancer in this time frame. They also had to be less than 21 years of age when they were initially diagnosed with their first cancer, and they have to have survived at least 5 years. So based on this cohort of children, they looked at a lot of different risk factors for developing a second neoplasm. And the risk factors that they found to be important were radiation therapy. So kids who got radiation early on did have some risk of developing a second cancer. The age, when you were first diagnosed, kids who are at a younger age were at a slightly increased risk of developing a second cancer later on. For some reason, females are a little bit higher risk than males, and we don't understand why. If there's a family history of cancer, particularly if there's another family member with either breast cancer or thyroid cancer, then the child is more likely to have a second cancer later on. And then again, what was your primary diagnosis? And what they found was, again, female survivors who initially in childhood were diagnosed with Hodgkin's lymphoma or sarcoma and had been treated with radiation therapy tend to be at a bit higher risk of getting a second cancer later on. They looked at what types of second cancers developed, and it did depend upon what your primary cancer was. So kids who initially had Hodgkin's lymphoma, the types of second cancers that we're seeing are skin cancers, non-melanoma skin cancer, breast cancer, thyroid cancer, sarcomas, leukemia, GI, lymphoma, melanoma, brain tumors, and bone tumors. Unfortunately, kids with Hodgkin's disease are at increased risk of many different types of second cancers. And this is the group that we need to follow the closest. Kids with leukemia also can develop second cancers like non-melanoma skin cancer. And you'll see this theme running throughout the next couple slides. So non-melanoma skin cancer seems to be a common second cancer. And so the recommendation is that patients be followed, do skin checks, look for new skin lesions. Depending upon your risk, consult visits to the dermatologist once a year, once every couple of years can be helpful depending upon your prior history and treatment. Soft tissue sarcoma, they too, again, it's non-melanoma skin cancer. Other sarcomas, bone tumors, breast cancer, thyroid, and melanoma. Bone cancer, also, again, skin cancer is a risk factor, or is a second malignancy that is often seen. Breast cancer, thyroid cancer, bone cancer, leukemia, melanoma, sarcoma, brain tumors. Patients initially diagnosed with brain tumors, we follow them for skin cancer, a second type of brain tumor. Thyroid cancer, if they got radiation, particularly to the neck region, some patients with brain tumors need radiation to their brain and spine, and radiation to the spine puts you at increased risk to thyroid cancer from the radiation. Sarcoma, bone tumors, melanoma, lymphoma, leukemia, and non-Hodgkin's lymphoma also, again, at risk for secondary skin cancer, as well as some other types of cancers. The type of second cancer you get does influence the survival. We can lump them either into solid tumors or to liquid tumors, which would be leukemias. Leukemias are more difficult to treat as a second cancer, and they require more aggressive therapy. Solid tumors, if you get a solid tumor as a second cancer, it is a little bit easier to treat, and survival is better. But again, I don't want people to panic, because we're talking about very small numbers here. We're looking at a 20-year incidence of a second cancer of only 3%. So 97% don't get the second cancer. A 30-year incidence of second cancer, it's only a 9%. A 30-year incidence of getting non-melanoma skin cancer is 7%. So again, the numbers are relatively small. So again, as the cup half full, I think we are definitely on our way to making things better. Survival is definitely going on an upward trend, with the vast majority of kids being cured of their cancer today, and very small number of kids getting subsequent cancers. So we're very excited. So anyways, thank you very much.